Hello, I am Dr. Nagaraj B Puttaswamy. Gallbladder stones or cholecystitis or cholelithiasis as commonly medically termed is one of the very common conditions which we experience in our lifestyle. See, why is gallbladder removed instead of trying to treat only the stones is one of the commonest questions where the patient comes in following being detected with gallbladder stones. See, gallbladder is an organ which is a reservoir for bile. The bile is produced by the liver. The bile entirely moves into the intestine finally. But what is the function of the gallbladder? Say, if in an average individual, about close to a litre of bile is produced every single day. There is a circulation called enterohepatic circulation. Entero is intestinal, hepatic is liver. So, there is continuous flow of bile produced by the liver which is going to the intestine and coming back in the form of portal absorption and going to the liver for reprocessing of dietary material. The bile invariably contains food and byproducts of food which is not fully processed and digested along with bile salts and bile pigments. So, this process is a continuous process even when we are at sleep. But what is the function of the gallbladder is important here. The gallbladder takes about say maybe 10 to 15 ml of bile, concentrates that into maybe 10 folds lesser. In the sense like the gallbladder takes in 10 ml, it will convert that into 1 ml. So, it will concentrate the bile, make it thicker, and when there is a consumption of food, when we eat something, immediately there is a signal going to the gallbladder so that the gallbladder pushes the concentrated bile for better absorption of fatty substances and fatty soluble vitamins A, D, E, K. So, these functions will be completely performed even if the gallbladder doesn't performs. So, I am just trying to make it a point that digestive system will function normally irrespective of the gallbladder being there or not. So, if the stones have been formed in the gallbladder, it's not who is the culprit, it is the gallbladder which is the culprit because there is some amount of infective activity which is going on in the gallbladder that has triggered the formation of the stones. In medical terms and textbooks, there is a description saying that gallstones are tombstones of bacteria. So, if they are tombstones of bacteria, where did the bacteria come in from? They came from the infected gallbladder. If we try and remove the stones and leave behind the gallbladder, there is a high possibility of the stones getting reformed. So, we try to delete the gallbladder or remove the gallbladder from the system. So, what if the gallbladder is removed? Almost no change. The bile which was already going from the liver to the intestine will continue to go there. Say, I usually try and term something like, if there is a highway, there is a bay, there is a bus bay. The traffic goes on continuously. If there is a non-stop activity, the buses try and go on to the destination. But if say there is a requirement for a short break, for a coffee break, the bus has to stay there for some time, complete the formality, again take the same route. So, this is how the bile transports. So, even if the gallbladder is not there, even if the bay would have not been there, the destination would have been the final, that is the intestine. So, removal of gallbladder doesn't have any impact on normal functioning, whether it is digestive, physical or mental. Any sort of activity will not be altered. This is one of the important clarification which I generally want to make. And parallelly, what is the dietary changes which an individual has to make? See, if a patient has been recognized with gallstones, I usually try and tell before surgery, try to restrict fatty food, meat, other type of non-vegetarian stuff. This is what I generally tell. Following surgery, what is the restriction? I tell no restriction. So, this is a huge advantage. So, following surgery, patient can do normal activity, eat normal food. So, it is a very convenient laparoscopic daycare surgical procedure, that is laparoscopic cholecystectomy, what we term laparoscopic removal of gallbladder, and it is done very easily if the patient is detected as a planned patient, in the sense a patient has undergone a simple master health checkup for some reason, official in the office they say that you do annual health checkup. The patient would have got that done, and then patient is detected to have a gallstone. It is a quiet gallstone or a silent gallstone. It has caused no symptoms at all. Should we do and rush and operate on those patients. There is no rush, there is no requirement. But should we operate? I definitely say yes. Why the gallbladder has to be operated is because we have seen life-threatening complications if it is not attended. How early? Say at the earliest at your convenience, because it can be easily planned. You can plan your holiday, you can plan your surgery, you can plan your finance, because there is lot of time. See, how is it different when compared to planned surgery and emergency surgery? A planned surgery is a weekend surgical procedure. Maybe Saturday morning if we get admitted, priorly invariably some amount of workup would have happened. Same day operate, Sunday discharge, Monday office. You don't even have to tell your colleague saying that I underwent a laparoscopic cholecystectomy surgery. Because the pain is so minimal, discomfort is so less, the cost is very, very effective, and we don't have blood loss, we don't have possibility of infection, we don't have possibility of post-operative hernia development. But in case if the patient has landed up in a surgery, I have seen patients in ICUs where the patient has developed cholangitis, patient has developed acute pancreatitis. So these are two complex life-threatening issues related to gallbladder infection or gallstones. Cholangitis is infection in the liver, and pancreatitis is infection of the pancreas. So if these two organs get into infective state, it is a very, very challenging condition. There we try and by lot of time we try to treat the patient medically, get the patient back to normalcy, only then plan interval cholecystectomy. That is maybe a couple of months after this episode. Maybe if the patient gets back into some similar type of medical acute condition, we have to rush and do it in between, taking high possibility of risk. What all are the risks here? Difficulty in identifying the structure, because the gallbladder would have been in a mass, intestine, omentum, stomach, and also the liver would have been in a big mass. It would get stuck there. Sometimes we find gangrenous gallbladder. Many a times we find pus very badly affecting the gallbladder. The thickness of the gallbladder is so bad. All these complications would have come in. So it is not easy for the operating surgeon to complete the procedure. And you have a possibility to land up in complications. Say maybe if I clip the cystic duct, which is relatively big, that may slip. There is a possibility of bile leak. Infective conditions may infect all my operating ports following surgical procedures. These are high possibilities. And also pain and trauma, the length of surgical procedure. In a simple planned laparoscopic surgical procedure, I can confidently tell I will do that procedure in less than 5-10 minutes time. Complex surgical procedure, it may go on to hours together. See, end of the day, the patient is a sufferer. So we don't want them to become targets or maybe think twice before planning for a laparoscopic cholecystectomy. What I generally suggest is, please do the gallbladder removal at your convenient time. Don't try to allow that to become complex. See, if I have to tell it in an understandable or an anecdotal state, say we identify a bomb placed in some place. Do we allow that to explode and cause physical damage, life damage? No. What we try and do is go and diffuse it as early as possible. We try to request the expert and they'll come and diffuse it. That is what I keep telling. Say, if you want to make it more simpler, I try and tell, if there is a simple caries tooth, do we allow that to become an abscess? No. I go to my dental surgeon friend, immediately ask him to request it to just drill and maybe fill in, so that it becomes perfectly fine, so that I don't get into complex scenario. These are common things which patients try to falter in making decisions.